So you might be asking yourself now or having some thoughts about whether trauma-focused treatment is appropriate for you, if this is the time. And this is where, I'll always defer to you, and it's a great time for a discussion with your clinician. And there are some ways we can really figure that out. The first step is to take that personal inventory of where you might be seeing the impact of trauma in your life. If you look back on your life and you notice that there are some events that stick out to you, what we really want you to do is check and see, how do I think about these? Do they come up a lot? Are they getting in the way of things I want to be doing? Are they getting in the way of my relationships? If those answers are no, if you understand these events, if they make sense in your life, that's okay. They really may not need much more processing. They may not need any. And when we look at the frequency, most people will experience a traumatic event at some point in their life. So this is common. We really just care about that recovery process. If you've gone through that natural recovery process, wonderful. Something I haven't mentioned is that if someone has experienced something traumatic, has experienced a traumatic event, it doesn't mean that they will have these trademark PTSD symptoms. Some people notice that they're maybe feeling a little more depressed. You might be noticing that you respond a little more in terms of anxiety. And that's important information. And we also want to look at that in terms of the timeline. You might notice that there are times in your life when you felt very depressed and you weren't thinking about trauma. You weren't thinking about the event. Maybe there were times you were feeling very anxious. Again, you weren't thinking about the trauma, but now it's really starting to come up. Now you're noticing it. And a way to try to conceptualize that, a way to make sense of that is, it's almost like a foundation. Trauma can function as this foundation where it is underlying depression, it's underlying anxiety. And on the top, we see, test anxiety, relationship anxiety. We see this persistent distress or depression, but we're really not treating that foundation. We're really not treating that trauma that's driving it. If you want to look at more objective information, this is what a lot of people can appreciate when, mental health is very abstract at times. There are some symptom questionnaires that you can pull up online. So, for example, if you're thinking about trauma specifically, the PTSD checklist, PCL5, pull it up, fill it out, and it's going to give you a great understanding of where you're at. If you're not scoring, all that high on it, wonderful. That's what we want to see. And we also might see that score fluctuate over time. Similarly, if you notice that your mood is low, depression seems to be the way that you're responding, PHQ-9, Patient Health Questionnaire, it would give you those depressive symptoms. For anxiety, some people use the GAD-7. It looks at generalized anxiety. These are going to capture the anxious, depressive, and trauma-related symptoms. But most importantly, it's going to give you that objective measure. It's going to give you that understanding of how you're being affected now, maybe versus other times in your life. Now, assessment is something that's ongoing. It's a common line in therapy, and it's basically saying that when we look at a person, we know that in that initial 1 hour intake, we can't begin to understand who you are as a person. We don't have enough time to understand who that complex individual is. But that builds as time goes on. And we might see later on that trauma is really something that's standing out. It really does warrant attention. So in that sense, we ask you to advocate for yourself. Try to make sure that you understand how trauma fits within your life, how it's affecting you. Now, you may also wonder what you can do in the meantime. You may not feel ready for specific treatment. You may not want to, take on such a large task right now. Maybe you've got a lot of life changes, job, housing, relationships, and you can start to develop some coping skills. In a moment, we'll get into some more specific coping skills and some behavioral approaches within life that we can really use to focus on some of those symptoms you might be experiencing. One of the focuses, if you decide that maybe CPT, cognitive processing therapy, that's a treatment you want to do eventually, you can start off with your provider in terms of CBT. Identify thoughts, identify emotions, become very skilled at making those links, and then you'll have that head start. You'll have that boost for when you do jump into that trauma-focused therapy. We can also look at how we're living in our day-to-day life, and engaging in self-care. When I mention self-care, I'm asking you to take, again, that very broad perspective. Look from that 30,000 foot perspective in terms of what the day-to-day looks like and how you are really focusing on your diet, focusing on your exercise, focusing on consistent behaviors. Next, we'll get into some of the effects of a very regimented focus on our diet, on our exercise, on our day-to-day, and how that can affect our mood, how that can affect when we're feeling depressed, how that can affect when we're feeling anxious, and some of these trauma symptoms themselves. Now, with breathing exercises, we want to be very deliberate. We want to start to implement them starting right now. We want to have this skill that we can reach back and grab it and use it and start to apply it regularly. So for starters, we want to focus on specifically how we're going to be breathing, and then we'll get more at the function, and you'll start to notice that as we're doing this. So make sure this is the right time for you to go through a breathing exercise. We want to identify what you're feeling right now, see if this is the right time for you, see if you're feeling like you need to bring these emotions down a little bit, or you may feel like you're at this point in a very comfortable place emotionally, and this is simply routine practice. For starters, we want to look at where we are physically at this moment. I'll ask you, for breathing retraining, the practice, sometimes it can be helpful to close your eyes. Some people may prefer to keep their eyes open. But I'll also ask you to take a moment and get comfortable in your seat. It's asking you to put your feet on the floor, your arms, if you're in a chair, maybe on the armrests or in your lap or cross, whatever's comfortable for you. Now, to talk about how we're going to breathe. We've mentioned it before, the inhalation and the exhalation. The exhalation is very important. We want to make sure that we're focusing on our timing. The modeling here, if we're just throwing numbers on it, and you'll find numbers that fit best for you, would be something like 3, 4, 5. So we'll have an inhalation of 3, we'll hold for 4 seconds, exhalation of 5. And you might notice as we're going through this exercise that there's naturally an extension there. We start with a 3-second inhalation, 4-second hold, 5-second exhalation, and then we're at a 4-second inhalation, 5-second hold, 6-second exhalation. We're trying to find what works for you. Now that you're comfortably in your chair, let's transition into the focus on how we want these breaths to proceed. So for starters, I'll ask you to put your hand on your stomach, your other hand on your chest, and take a moment to notice how your breathing is happening right now. You may notice that the chest is rising a bit more than the stomach. And this is giving us a clue. It's indicating that the breaths aren't necessarily as deep as we want. Ideally, we want these deep breaths that are causing the stomach to go out as well, and oftentimes first. So we're taking a breath in through the nose, holding, and blowing out through the mouth. That's the pattern we'll be following. In through the nose, holding, and out through the mouth. Once you practice that a bit and you feel that you have that down, you can put your hands back in your lap. Now, take a few moments, and I'll count the breaths for you as you're breathing. I'll ask you to go through a few deep breaths here. I'll ask you to observe what you feel in your body. In through the nose, hold, and out through the mouth. Now, in through the nose, 2, 3, 4, hold, 2, 3, 4, 5, out through the mouth, 2, 3, 4, 5, 6. If that felt right, continue with that pace. If that felt a bit long, reduce it a bit, but continue with the breaths. In through the nose, 2, 3, 4, hold, 2, 3, 4, 5, out through the mouth, 2, 3, 4, 5, 6. Now, if you need to, take a moment, pause the video, go through a few of these deep breaths. For some, it's 3, 4, 5 breaths. For others, we take a few minutes. Ideally, we get to a point where we can breathe for about 10 minutes. We're setting this time aside in the morning, in the evening. We want this to be very routine because we'll start to notice a transition during the day. As we're focusing on our breathing, we're making sure that we're breathing in a deep manner. We're going to start to notice times in which we're feeling somewhat anxious or somewhat uncomfortable. And then we'll start to link that back to our breathing. We'll start to observe that our breathing is a little more shallow in those moments. We're not breathing in this manner. And this is a great practice to employ throughout the day. If you're sitting at your chair, sitting at your desk, whatever it might be, practice it.